Despite best efforts, accidents in the aged care environment occur, harming both residents and staff. These accidents are often preventable. In this video, we will look at safe practices when moving and transferring residents. We will particularly focus on the importance of the 3C's, which are communicate, check, and commence. Is the first step to complete a task safely. When entering a resident's room, greet them and tell them what you are going to do. Don't be loud and don't rush. Lifts and transfers can make a resident feel anxious, even if they've done it before. It is important that they understand what is happening and that they feel comfortable and safe. It is also essential that you communicate with your fellow caregiver. It is important that you talk to each other in order to carry out the task safely. Before any lift or transfer takes place, safety checks must be carried out. Check the equipment. Ensure that you have the correct equipment for the task at hand and that it is in good working order. Check the resident. Are they reporting any issues, such as feeling unwell? Something as simple as a chest infection can affect your resident's usual functional ability. Are they exhibiting behaviour that isn't normal for them? For example, if they indicate anxiety or show signs of aggression and it's not safe to move them, then don't. If you are unsure, always check with registered staff on duty. Finally, check the environment, ensuring that it is clear of hazards and uncluttered. This is all part of your dynamic day-to-day risk assessment. If the transfer being carried out requires a lifter, there must be 2 caregivers, and the lifter must meet the resident's needs. There are several types of lifters. These are the most commonly used. To safely use a standing lifter, the resident must be able to weight bear. They must be able to use their arms to hold the lifter, and they must be able to follow instructions. If the resident does not meet these requirements, they may need a full lifter. As well as this, the sling used must be compatible with the lifter. If you are using a standing lifter, a standing sling must be used. And if you are using a lifter with loop attachment points, a loop sling must be used. The sling must also be free from damage, and you must be able to read the labelling, including the sling's safe working load. If you cannot, do not use it. If the transfer being carried out requires a walk belt, ask the resident to lean forward and place the walk belt behind them. Ask them to lean back again and fasten the straps. Standing at each side of the resident, hold the walk belt using the handles on their side. Ask the resident to lean forward, nose over toes, and to use their arms to push up from the chair. Remember, the walk belt is used to assist. It is never used to pull the resident into a standing position. When walking, hold the walk belt as we see here. In the event that the resident begins to fall, use the walk belt to gently lower them. Do not pull on their arms or shoulders. To move a resident using slide sheets, there must always be 2 caregivers. It is important that the bed is at a safe height for you, the caregiver, and that you stay close to the bed to protect your back. In any transfer, always remember your safe manual handling practices. The spine is naturally S-shaped, and maintaining this S shape when carrying out day-to-day activities helps to protect your spine and prevent injury. This is your spine's protected position. In this position, it is very difficult to damage your spine. When rolling the resident to position the slide sheets, do not lean forward. Remember to maintain your safe, straight spine. When slide sheets are in place, communicate with each other to coordinate the movement. Hold the top sheet to move the resident. Your handhold should be close to the resident and near their shoulders and thighs. Use your legs and body weight to slide the resident on the bed. Do not lift. By remembering your safe manual handling practices and the 3C's, communicate, check, and commence, You can ensure that both you and the resident stay safe when carrying out transfers.